Yes. Welcome to the Nurse's View, where we wear stethoscopes. Not doctor stethoscopes, not nurses' stethoscopes, just plain old stethoscopes. And now, introducing our hosts, we have Mackenzie, Lauren, Dee, and Jordan.
Today we are here to talk about Beta-2 agonists.
Okay. Later on today, we have special guests Andrew and Brendan to further explain the pharmacological aspects as well to answer rapid-fire questions.
So what are beta-2 agonists and what do they do? Beta-2 agonists work mostly on the pulmonary system and are considered first-line therapy for the treatment and prevention of bronchospasms in patients with reversible obstructive airway diseases.
Oh, like what?
Such as asthma, bronchitis, emphysema, COPD, and treatment of exercise-induced bronchospasm.
Oh, I know people who have asthma.
So that's lungs, right?
Yeah.
Oh, okay.
Definitely.
All right.
But there are two types of beta-2 agonists. There's short-acting and long-acting. So short-acting help to relieve symptoms, and long-acting help to prevent breathing problems.
So salas and lalas.
Okay.
So now we're going to talk to Andrew about their mechanism of action, absorption, excretion, and metabolism.
Let's go.
Hello, Andrew.
everybody.
Hey.
Thanks, I got it. From a doctor. Oh, what are we talking about today?
Tell us about beta-2 agonists.
Oh, okay. So beta-2 agonists' main mechanism of action is to act on the smooth muscle cells of the bronchioles and relax them in the treatment of bronchospasm.
Meaning they relax and dilate.
They relax and they dilate them. Very good.
Oh, good.
Airways in the lungs, so they make it easier to breathe.
Well,
Okay.
it's important to breathe.
Yeah.
Now, the main way they're absorbed into the bronchi is through the alveoli, and from there they're distributed into the blood.
Okay.
After distribution, they get metabolized in the liver and cross the blood-brain barrier, and in pregnant women, the placenta, and from there they're excreted in the urine.
Oh, okay. Cool. All right.
Thanks, Andrew. Now let's talk to Brendan about appropriate nurse implications and labs that we need to assess prior to, during, and after administration.
Welcome in.
I'm doing pretty good. Thanks for having me.
Yeah, no problem.
So, I got the memo about the stethoscopes.
Nice.
I like it.
Anyway, so just first and foremost, if you are a patient who is using a beta-2 agonist, you should not smoke. All that is going to do is just greatly exacerbate your symptoms.
Okay.
Okay, you should also avoid irritants such as pollen, cats, smoke, dust. So be careful where you live, what kind of pets you have, and also where you work.
Jesus.
All right, you should also maintain an ideal body weight. Obesity is a very bad problem, and it can definitely exacerbate a lot of diseases, especially those where you're going to have to use these beta-2 agonists.
Okay.
Patients should also pre-medicate if you before exercise, especially if you are diagnosed with exercise-induced asthma. All that's saying is, if you're going to do some exercise, it could exacerbate your symptoms, so we want to pre-medicate you so you can go out and exercise safely. Patients using beta-2 agonists should identify their doctor if of all their medications. So what we do is we use pulmonary function tests, and they measure the forced expiratory volume and vital capacity. So what you're going to do is twice a day for 2 to 3 days a week, you're going to use a peak flow meter, and it's going to establish your baseline or your personal best of your forced expiratory volume. So what you're going to then do is once a day use your meter and compare your results to your personal best. Now we have green zones, yellow zones, and red zone. So green zone is anything 80% and above, and that's good, that's where you want to stay. Now if you go below that, you go to the 50 to the 80%, that is your yellow zone. And if you do happen to fall on that, you just want to use your medication, like your albuterol, which is your short-acting beta agonist. Now if you do happen to fall below the 50% range, you do definitely want to use that medication, but also go to the hospital and seek emergency medical attention. So
Okay.
at the hospital, our nurses, they will be monitoring your lung sounds, your respiratory rate, and they also will be watching your heart rate and your rhythm. While beta-2 agonists do act primarily on the lungs, they do have a small effect on your heart, so we just want to be careful and watch that, okay? So we will follow up just to make sure that we want to get you to all of your appointments, that you're taking all of your medication and taking it correctly, which is very important. And especially over-the-counter drugs that we use for asthmas, coughs, colds, fevers, sinus problems, because they could increase the unwanted effects of the medication that you are already taking.
So what about ABGs? Do we assess for ABGs when we're using this kind of medication?
Oh, absolutely. I'm so
What
sorry
are
about that, guys.
ABCs?
ABG, so those are your arterial blood gases. So that's going to measure the oxygen content, the CO2 content
Okay.
of the blood. So that way we can always make sure that, yes, we can listen, but that's a more specific value that we can go by that is more accurate.
Oh, all right.
Oh, thank you. That was a lot of great information. Thank you.
Thanks.
Glad to be of help.
Thank you.
All right, so now we're going to go back to Andrew. So he's going to talk about medication forms and appropriate dosaging and usage.
So beta-2 agonists come in a multitude of forms, not limited to metered dose inhalers, dry powder inhalers, a nebulizer, pill-injected inhalers, and even syrup forms. Common dosage for children is 0.1 to 0.2 milligrams per dose, and that's for ages 2 to 6. Children ages 6 to 12, typically they get 2 milligrams per dose, and in adults, anybody 12 and older, appropriate dosage is 2 to 4 milligrams per dose. Some factors that affect these doses are age, weight, their sensitivity and reaction to the medication, and the reason for being on the medication in the first place. There are also many devices that facilitate delivery of the medication. A spacer with a one-way valve may be used in order to ensure proper use of the inhaled devices.
Okay.
Without a spacer, it says that about 80% of the medication ends up on the back of the oral cavity. With the spacer, 80% of that medication is delivered to your respiratory system.
Okay.
And only 20% ends up in your oral cavity.
Great.
Okay.
Tip.
When 2 puffs are needed, it is really important that you give it a 1-minute interval between each puff. Additionally, patients should always rinse their mouths out after using any kind of this inhalation medication.
Why?
It can cause gingivitis or other sores and sensitivities in the mouth.
Yeah, I think I got a cousin that got oral thrush from this once after they didn't rinse and spit.
I didn't know that
That's not
happened.
It's important to rinse and spit.
Thank you, Andrew.
All right. So thank you, Andrew, for that great information.
You're welcome.
The cast here on the Nurses View, myself and my lovely colleagues over here, we've done some research on the common side effects of beta-2 agonists, and they include headaches, anxiety, nausea, muscle tremors, nervousness, and an increased or irregular heartbeat, which is commonly known as palpitations.
Doctors are also cautious in prescribing beta-2 agonists to anyone who is pregnancy category C, has cardiac or renal disease, seizures, diabetes, glaucoma, hypertension, hyperthyroidism, and in children under 12 with exercise-induced asthma. Beta-2 agonists are also contraindicated in patients with hypersensitivity to inhalants and their components, and for patients who have tachydysrhythmias, severe cardiac disease, heart block, and are at risk for abortion in their first or second trimester.
Okay, so what about patients with diabetes? So these medications could cause blood sugar levels to rise, which could change the amount of insulin or diabetes medications you would need to take. So it's important to be aware of that.
Also, for patients who are using epinephrine injections, or most commonly known as your EpiPens, it's possible that the epinephrine can cause damage to your tissues when it's injected in one spot too often. So you want to rotate your sites and always make sure that if you feel severe pain in that site, to check with your doctor.
Yes.
Just one thing, while you are using your epinephrine, we want to be careful of the older population because we definitely don't want to use that harsh of a stimulant on somebody who may not be able to handle it.
That's
Good
very
tip,
true.
good tip.
Good tip.
Now,
All
why
right.
would someone be using epinephrine?
For an allergic reaction.
Yeah,
Oh.
life-threatening allergic reaction.
And why would they need the epinephrine?
For their allergic
Andrew,
reaction.
Brenda, you want to know what you're telling?
Because their throat swells up, and
Ah.
sometimes the beta-2 agonist isn't as effective as opening that airway up as epinephrine.
Oh, okay, all right.
It's a great tip, specialist Andrew.
Way to make it
Thank
sound
I think I
hard.
learned that next semester.
Yeah. Does anybody have any more comments?
No, I think that was a great discussion, guys.
All right,
Well,
guys.
thanks a lot for having me.
You're welcome.
Yeah,
You're
thank you.
welcome.
Thank you,
for
Brennan.
Okay.
You're welcome. It was a pleasure.
Thank you for joining us today on the Nurses View. Also, a big thank you to our two specialists, Andrew and Brendan, for coming to join us today
Yes.
to talk. We'll see you next week in Pathopharmacology, and shout out to Dr. Martin.
Yes.
Are you ready?
Why?
Oh, we're
5.
I'm recording.
4, 3. Well, can you do that, director?
Are we filming right now?
Yes.
Oh, 5, 4, 3.
Cut.
Yeah.